And we're back on Talk with the Doc with Dr. Tim McKnight, who is having a little more difficulty talking than usual. So we appreciate your effort to get here. So,
thank you.
Seriously. What do you got? I mean, what's wrong with you? Are you congested?
Well, I have some type of an upper respiratory infection. Not sick enough to stay home. I've been tested 2 or 3 times now for COVID, and it's negative, although my wife is just recovering from COVID. So I haven't had a voice for 3 or 4 days.
Which she's glad about. No, I don't know.
She may be, yeah. But I'm feeling well enough to work, and I of course I wear a mask, so I don't think I'm infecting anybody else.
Right.
But this is one of those things that I thought, when you have these kind of symptoms, you go to the pharmacy or you call your doctor and you say, "What can I take?" Well, I've got my visual aids here. It's my share and tell day here with you. Just the things that you would think about when you have one of these kind of colds. So for me, it started as a sore throat, and then it developed into a kind of a dry, hacky cough. And so the first thing you look for a cough is something that's an expectorant and then a cough suppressant, which doesn't really make sense. An expectorant is something that helps to loosen up the mucus in your lungs, and then a cough suppressant suppresses it. So that doesn't make sense that you would loosen it up and then suppress the cough.
You want it out, so which way should you go?
You want it out, and what happens is your body will naturally cough. There's a cough reflex, and when there's a trigger for a cough, you get enough mucus in your lungs, you'll trigger the cough, and it'll come out. So the cough suppressant just sort of suppresses the cough enough that you're not coughing all the time, which is what we don't want to do. And the expectorant is guaifenesin. We call it a mucolytic. It breaks up the mucus. It makes it a little bit more loose and not as thick, so it comes up easier. So that's Mucinex DM is an example of that. So that's strictly to help break up the secretions in your lungs and to help you bring it up when you cough, but not cough as much. And this is a 12-hour medication. If you need to go stronger than that, a stronger cough suppressant would be a prescription grade. Tessalon pearls are these little, I guess pearls are round gel caps that has a stronger antitussive or anti-cough effect. The top line cough suppressant would have codeine in it, so Robitussin with codeine or guaifenesin with codeine. So we're still using something. The guaifenesin is the mucolytic to break up the secretions, and then the cough suppressant is codeine. And in Robitussin DM, it's dextromethorphan, which is sort of a same family as a morphine. It's not a narcotic, but it's kind of in that same family to suppress the cough. So Mucinex DM. Then the other issues that I've been having is just the sinus congestion. So I usually get the generic brands, the Equate brands, because I don't think you need to spend a lot of money on the name brands.
Yeah.
Right. So they have whether it's Tylenol PM or Tylenol Day, or in this case it's Equate Mucus Relief Severe Cold, Mucus Relief, Mucus Cold Relief, and Flu. There's a nighttime and a daytime. So in the daytime, what you get with most of these is acetaminophen. So you get a little bit of Tylenol for pain or fever, and then you get dextromethorphan for the cough suppressant. You get a little bit of the guaifenesin is the mucolytic, but then for the sinus congestion, you get phenylalanine phenylephrine, which is the antihistamine that sort of stops the runny nose, and that's what you want in the daytime.
So that's the sinus treatment.
That's the phenylephrine is the sinus treatment. You can take Zyrtec or Allegra also, but that's just for sinuses.
Yeah.
So this gives you something for the fever or the pain. It gives you something to suppress the cough, to break up the secretions, and then something to dry up the sinuses.
So there's an added ingredient for nighttime, which causes drowsiness.
That's right. And the nighttime ingredient is the same thing, but they take out the they leave the phenylephrine in, but they often add, in this case, they add Benadryl. Benadryl is a good antihistamine to dry up the sinuses, but it also makes you drowsy. So men need to be aware that these cold medicines, whether it's phenylephrine or even Benadryl, if you have any issues emptying your bladder because you have an enlarged prostate, that can make the urine flow weaker. And if you're already having problems with your urine flow, this could actually make it almost impossible to void if it's bad enough. So men need to be a little bit careful with this. These antihistamines like phenylephrine also can, they kind of constrict the blood vessels, and they can raise the blood pressure a little bit. So if you have issues with blood pressure, you might want to avoid these. Now, it's not going to raise it 20 or 30 points, but it may raise it more than you want it to. So there's a line of cough and cold medicines called Coricidin, HPB, and that stands for high blood pressure.
I think it has a little heartbeat on the label.
Probably, I think it does. You're right. And the HPB is for high blood pressure. So the ingredients in Coricidin HPB don't increase the blood pressure. So you can get a Coricidin HPB for cold, and you can get Coricidin HPB for cough. And whichever symptom is predominant, you can treat that. Then we have just plain old allergy relief medicines, as I mentioned. This is an Equate brand, cetirizine, which is it compares to Zyrtec. And that's just going to help to dry up the secretions a little bit. On top of all this, I've been using cough drops. I like the cherry flavored cough drops, and they do help to suppress the cough. Now, a lot of people, when they get this way, the first thing they do is they say, well, I have a sinus infection. I need an antibiotic. Well, I've had this for about a week, and my, not to be disgusting, but my mucus secretions are not clear, nor is what I'm coughing up. It's not clear. It's got color to it. And people normally think when there's color, there's bacterial infection. That's not necessarily true, and it's not that something that you necessarily need an antibiotic for. I would prefer, I'm not on an antibiotic. I'm on day 7 or 8 of this, and I'm starting to get better. It's really knocked me more than most colds get me, but I'm starting to get better. So I don't need an antibiotic. But I think we need to be cautious about jumping to an antibiotic too soon, because when when bacteria see these antibiotics, what happens is the weak bacteria are immediately killed by the antibiotic, but there's some bacteria that are stronger, they're hardier, they're more resistant. And if you only take your 10-day antibiotic for 7 days, you kill all the weak bacteria, but the stronger bacteria, they see this antibiotic and they become resistant to it. They say, we're going to fight this. So now you have a strain of bacteria that's no longer going to be killed by this antibiotic, and that's the resistance that we see. And we're left with a few infections now. Some of the methicillin-resistant Staph aureus infections, we call them MRSA. There's not too many options left. We've got 2 or 3 medications, and then we don't have any more to kill it. So we want to be really careful about taking antibiotics when we don't need it. Now, there's some people that have, bad lungs, and maybe somebody with emphysema, or somebody that's got a very compromised immune system, that we play it safe and let's just treat them. But for an average healthy person, when you get a cold like this, you should just ride it out. Now, what would alert you to need an antibiotic? Well, probably a fever, chest pain when you cough, or more difficulty with your breathing, or just in general more sick. But that's left for each person to decide how sick they are, and that's where your primary care doctor comes in to help you decide, is this something you can manage with over the counter, or do you need an antibiotic? And when there's a pneumonia involved, we can usually hear that with our stethoscope, and or we can see it with an x-ray. Maybe we'll order an x-ray. But I think we should be careful about jumping right into antibiotics and calling and saying, I need something, because most of the time we've survived a long time without antibiotics. And even if I have a bacterial infection, I'm getting better. And my immune system, I trust it enough to be able to help me with this. So I'm treating symptoms. I'm getting a lot more rest. I'm drinking more fluids. And I'm overcoming this eventually. So I think that's the message, is trust your immune system. And we kind of have to, because if we take antibiotics for every condition we have, we will be eventually resistant. And the other thing that people don't realize is, you have a lot of bacteria in your gut. And bacteria is a line of defense, believe it or not. You have bacteria in different locations in your body. And what they do is they crowd out the bad bacteria. So if bad bacteria enter your gut, they have nothing to feed off of, because all the millions and billions of bacteria in your gut are already there, and the bad bacteria have no space to get in and invade. And if we start killing off these good bacteria with antibiotics, we're taking an antibiotic every month. Now we can end up with intestinal infections.
Yeah.
C. difficile colitis is one that's also very difficult to treat. We're running out of antibiotics to treat that effectively. What I used effectively 10 years ago for C. difficile colitis, I rarely am able to have success with it now. And we're going to the top line treatment, and there's only one other one we can use for that. So we've got to be really careful of this, and we have to trust our immune system, and go to the pharmacy, talk to the pharmacist. The only caution here, again, with these over-the-counters is, do you have high blood pressure? Could these affect your blood pressure? And if you're a man, do you have prostate issues? Could this make a prostate issue or an emptying issue worse?
And pretty much no other side effects other than perhaps some drowsiness, maybe.
Yeah, exactly. Some drowsiness. The mucolytics, the phenicin, can make your mouth dry also. And to break up these secretions in your lungs or in your nose, we do really recommend you drink a lot of water, because we don't want to over dry it and then you can't get it out. We want to dry it up enough, but you need enough mucus, or you need enough water in that mucus to be able to expectorate it and get it out.
Right. Well, you do sound a little different, but you're threatening my radio voice. So
This is my soft, smoky, sexy voice, and that's as good as it gets.
Dr. McKnight, thank you so much.
All right, thanks.
Dr. Tim McKnight this morning. Talk with the Doc, brought to you by Mako's Pharmacy